everyone. I did my presentation on the BASC-3 Behavior Assessment System for Children, third edition. I have filled this one out quite a few times in my position as a preschooler, and I felt very comfortable kind of exploring it a little bit more since I've filled it out. So that is why I chose this assessment. Here's table of contents. I'm going to go over what it is, measuring skills involved or the skills that are measured, the different components, administration, scoring, critical items within the assessment, things to consider, reliability, validity, implications for us, strengths, limitations, and then the summary. So what is the BASC? It is an evaluation assessment that covers behavior, emotions, and adaptive skills. It is widely used to help provide intervention strategies. It can be used in the home and at school and within different areas, which I'll get to a little bit later. But it also covers ages 2 to 21. So measuring. So it will measure like externalizing problems. So these are the kind of problems that students, they're very aggressive or they're hyperactive and they can't focus. It also can measure internalizing problems like anxiety, depression, and school problems like academics and attention in the classroom. Some of the specific skills it looks at is adaptability. So, like if they're able to take care of themselves, use the restroom, get dressed, that's kind of like what the adaptive skills are. Social skills, that is how they interact with their peers. Functional communication is their ability to hold conversations, talk with, inform, let you know what they need, and leadership. So there are six different possible pieces to this. There is a self-report of personality. So the student, if they are old enough, can rate themselves. There is the parent rating scale, which is you give it to the parents and they fill it out according to how the child behaves at home and then maybe like outside in the community, like if they're at practices or things like that. Then there's the teacher rating scale, which is obviously the teacher fills out. And then there's the structured developmental history background. So basically, it's background information. There is the student observation system. So it's observing data in the educational setting. And then Flex Monitor, which is monitoring shorter intervals. I really liked this quote. I kind of came across it while I was doing my searching. I could not find the author. I searched and searched and searched, and it didn't give me a specific author. It said it was kind of like an idea for songs and things like that, and different various things. But the quote is, "Disability is not a roadblock. It's a detour to greatness." And I think a lot of times we stop and forget that these are real people, um, and they have a life outside of being in the classroom. And um, I think we just need to remember to respect that sometimes. So, administering it, you can do it digitally. You can also do the paper version, which is what I've always done. I've never had the opportunity to use the digital version of it. It takes 10 to 25 minutes, and then you can have multiple assessors. So, like the components part, when I was talking about that, that's where like the teacher can do it, the parents can do it, the student can do it themselves. So scoring. So if you do it online, obviously it will generate a report for you automatically, and then you can get other reports within that. If you do it manually, you add up the raw score, and then you convert it to your T-score, and the mean is 50. So anything that is 60 or less is considered normal and in the normal range. If it is 61 to 70, it's like slightly elevated, like, okay, maybe something's going on here. We might want to take a little bit closer look. And then 71 plus is extremely at risk. And this I did not realize until I started doing my research, which I kind of liked. I did not realize that there were specific critical items on this assessment. So self-harm or harm to others, aggression, depression, tension, hyperactivity, or if somebody answers like almost always to being irritable and uncomfortable, or if they answer never to being happy or upset. These kind of items usually require you probably want to follow up immediately, check in on them, and definitely focus on interventions and progress monitoring, even if the person does not qualify for a disability, because sometimes mental health has kind of really taken a huge leap lately, and even if they don't qualify for services within special needs or the eligibility categories, um, it's still very important to keep an eye on these kiddos that are marking these things or if you are seeing these things. Things to consider. So within the assessment, there's patterns. So like if you're examining each section, the anxiety and depression could be slightly elevated, and then that would also make the withdrawal extremely elevated. So if you're anxious, depressed, you tend to stay with yourself. You don't usually seek anything. So you kind of find patterns within it. And it's super important to look at the child as a whole, because otherwise you will not, you could just have one section that's really, really low, one section that's really high, and it's very important to look at everything holistically. Uh, the middle part here, the discrepancies, um, I've had this happen multiple times actually. I've filled it out and I've had parents fill it out. And I've had parents that score the child extremely, extremely, extremely low. Not sure sometimes if they do that on purpose or if child really behaves like that at home. So then you can get different ratings, and then you kind of delve into the area of environmental factors. Okay, so if this is happening outside of school, what's going on that, maybe you can help parents out and figure things out that way. Or if it's the opposite, maybe they're great at home and it's horrible at school. So um, it's just important to keep in mind that if you have multiple people doing the assessment, it's beneficial to get as much information as you want, but it can also be detrimental, and you can have uh, conflicting scores. Uh, Also to consider like qualitative data with this. Uh, this assessment's not necessarily made to be used as a be all end all. Okay, they scored higher than 70, so we need to do something about it. You want to incorporate observations and interviews and patterns of timings of their behavior, like maybe there's certain parts of the day that are worse than others, like transitions or things like that. So it is a great tool, but it's also very important to use it amongst other tools. So reliable. It is a reliable test. Typically, if you would test and retest, you within 4 weeks, you would get the same consistency and the same answer or same scores or very similar scores. Valid. It is kind of a valid test. There's strong validity that supports it. The scales, like I said earlier, you'll end up possibly seeing patterns in things, and it also can correlate with clinical diagnoses like ADHD, the anxiety, and depression, even though those are not specifically disability categories. They this test can help assess those and look at those pieces as well. So, implications for us. What can we do? How is this helpful? Why would we do this? So, one of the categories that it would help identify is OHI. An example of that, kind of like what I just said before, would be ADHD. ADHD is not a category, so it would fall under OHI. So, this assessment helps identify OHI eligibility. It also looks at the social communication. So for students with autism, the autism spectrum disorder, that's another benefit for this assessment. And then emotional disturbance identification, since it looks at behaviors and adaptive skills and things like that, that it can also help identify those disabilities. Now, the MTS intervention part of the implications. So it tracks behavioral progress. And then it can also help ID tier 2 and tier 3 students when it comes to our MTSS pyramid. Um, and then the best informs the SEL initiatives. School psychology, continued considerations. So, kind of, I mentioned it a little bit before too. This assessment should not be the sole determining factor for diagnosing somebody. It should be included amongst other assessments and other opinions and the team's other observations and interviews. And it's also important to realize that cultural and language can also influence scores. If you have students with language barriers, this might not be the best one to possibly use, and different cultures have different behaviors. So this could potentially not give us a correct or straightforward answer if the child is not necessarily of of our background. So strengths, it gives you a well-rounded view of the student. It checks multiple things. It aligns with IDEA. The adaptive skills and positive behaviors are also noted. So not only does it just look at negative behaviors and uh, anxiety, depression, things like that, it also looks at positive behaviors and things that the student is able to do. It's reliable and it is valid. Couple of limitations is the bias. This is where I think feel like when I fill it out, it's kind of hard for me. I try to be as objective as possible, but you have to answer sometimes, always, almost always, or never. So it can tend to be a slightly biased or judgmental assessment, and it might not highlight certain behaviors. Like there could be certain behaviors that a child is experiencing, but this particular assessment may not cover those behaviors. So again, that's where you need to incorporate more with it. And then it is kind of a little difficult measuring and interpreting the scales times with converting the T-scores and stuff, unless it's the online version. So summary, I put that it's comprehensive, emotional, behavioral, and adaptive assessment. It is research-based. It can help identify students with disabilities and help lead you to interventions. And it is extremely effective when used as a piece of an evaluation, not just a sole evaluation. And then here are my references. Thank you, and I hope you guys have a great end to your semester.